Hi again. Let's talk about the trigeminal nerve first, and we will look at the three branches. So I'll probably do 3 short lectures on each branch, 1 lecture for each branch of the trigeminal. So, overview. This slide is showing the dermatome. So on the left, these are regions of the skin, approximate regions of the skin that are innervated by each branch of the trigeminal. So, this is for V1, etc. So, keep that in mind when we're talking about these sensory nerves, covering the bridge of the nose, the eyelid, that sort of area. And then V2 is the maxillary region. So all of the maxilla, all the maxillary teeth, something like this, more or less. So the upper lip up to the bridge of the nose, and then the mandibular region, part of the ear, and then the chin, and all of the mandibular teeth, etc. for V3. So that's what we're talking about. And remember that these dermatomes are sensory areas for the skin. So the figure on the left shows a person tickling the face with a little paintbrush, and the patient can feel that in these different areas, and the idea is that those sensory signals are being carried by each branch of the trigeminal. Here is the ganglion. So there's our trigeminal ganglion. And notice, if you kind of magnify that up or pay close attention to detail, that you can see the cell bodies in the ganglion. So the picture again for these sensory neurons, that they're coming from the receptor out on the skin, and they're going into the trigeminal ganglion, and then there is the cell body, and then it continues on into the brain, and this is all one single sensory neuron. So there are the cell bodies in the ganglion. We're not going to worry about the cervical plexus. We're just dealing with the face. So we will just be looking at the trigeminal, and our next slide is introducing the 3 major branches of the trigeminal. So this is all we're going to do in this short lecture. This will be for the ophthalmic branch. But what you need to remember is that there are 3 main nerves of this ophthalmic branch of the trigeminal. And we'll go through them in order: the frontal nerve, the lacrimal nerve, and the nasociliary nerve. So here again, on the bottom right figure is a picture of the dermatome. So just to remind you, we're dealing with V1. This is the ophthalmic branch, and there are 3 nerves of it, or 3 major nerves. So again, keep in mind this dermatome area. It'll help sort of make sense of what we're going through. So let's do the frontal nerve first. And the figure, this is out of your textbook, so if you spend some time with it, which I would encourage you to do, you just kind of have to look at it and think about it for a while. Here is the ophthalmic branch, which I'm sort of circling in red. And then here is the maxillary branch, circled in green, and then the mandibular branch circled in yellow. And so you can identify those 3 branches of the trigeminal, and you know how those branches pass through the skull. Mandibular through the foramen ovale, maxillary through the foramen rotundum, and the ophthalmic through the superior orbital fissure, the SOF. So here are the 3 branches that we're looking at. The frontal branch, you really kind of have to pay close attention on this figure. It's kind of small in this figure, in this slide. But there's the frontal nerve, and there's the nasociliary nerve, and here is the lacrimal nerve. So they're pointing to these three branches. So again, it's kind of hard to see. I'm going to use, let's use red, I guess. Here are the three branches. Lacrimal, frontal, which I drew in blue, change that to red, and then the nasociliary. So, there are the three, 1, 2, and 3. So the frontal nerve is made up in turn of two principal nerves, the supraorbital and the supratrochlear. So if you kind of follow this along, we're dealing with the frontal nerve, and the supraorbital nerve branches off and goes up onto the forehead. And as mentioned in the text, it either passes through the supraorbital foramen or the supraorbital notch. And we looked at those when we were studying bone features. And again, that goes out onto the forehead and the anterior scalp. So you can just kind of refer back to the dermatome, and we're doing the forehead and the scalp. The supratrochlear nerve is running over the trochlea of the eye extrinsic muscle, and it innervates basically the same area: bridge of nose, medial forehead, and upper eyelid. So the main idea here is that you have the supraorbital and the supratrochlear being the two main nerves of the frontal, which is a branch of the ophthalmic. So I think practicing by looking at a picture like this, maybe enlarging it, and maybe blanking out those pieces of the nerve that you need to know, maybe putting sticky notes over the labels, and then come back to it later and see if you can still identify the different structures. This picture is a little bit confusing. I don't really like it because I've looked at this for a while, and if you watch the frontal nerve, it's the middle branch here of the ophthalmic, and then you get to this region on the eyeball, and it looks like it drills a hole through the eyeball there, and you wonder what is going on there, and then they're passing through the eye. Well, I think it's just the artist's way of indicating that the nerve is behind the eyeball. I don't really like it, but that's what we work with. So the point is the nasociliary nerve is not drilling a hole through the eyeball right there. That's showing a bony foramen behind the eyeball. It should be dimmed or shaded if I were drawing it. So let's move on. We're still in the ophthalmic branch, and here is a cleaner picture perhaps showing the ophthalmic nerve passing through the SOF. Okay, and it's showing the frontal nerve, and this is nice and clean, runs out, and there's our supraorbital nerve and our supratrochlear nerve. Shows a nice clear branch point from the frontal. It also shows the lacrimal nerve, which we'll look at next, going to the lacrimal gland. Now, keep in mind what the lacrimal nerve is doing at the lacrimal gland. Is it sensory or motor? Or is it both? So it's a gland, so if it's going to be, any motor function of the gland is going to be done by the autonomic. So this, and we know the motor pathway, the parasympathetic motor pathway to the lacrimal gland, right? It's a branch of 7, facial. So this is not motor. This lacrimal nerve is sensory. So just kind of keep that in mind. And that's probably about it for this slide. So here's a little bit on the lacrimal nerve. So we did the frontal and its branches, and then the lacrimal nerve. Here we go, sensory for the lacrimal gland, the upper eyelid, and the conjunctiva. Okay, here's the piece on the parasympathetic that I have tried to introduce you to and get you started on this. So we're talking about the lacrimal nerve, branch of the ophthalmic, and the lacrimal nerve is carrying those postganglionic parasympathetic fibers of cranial nerve 7 to the lacrimal gland. And you remember that pathway. Had the greater petrosal nerve and the pterygopalatine ganglion. Just review your parasympathetic pathway to the lacrimal gland. And it should come back to you. And that's this note. Okay? You've already done the parasympathetic pathways. It shouldn't be a big deal at this point. So let's go to the next slide. And then here's the nasociliary nerve. And the nasociliary is this one that's sort of running behind the eyeball. Looks like it's trying to drill a hole through it again. And it's carrying sensory from the apex and the ala of the nose. So nose is probably good enough for me. And then the ethmoid and the sphenoid paranasal sinuses, because it is a nasociliary. So the nasal is from these ethmoid and sphenoid nasal sinuses, and it also is carrying sensory information from the cornea. So a little bug gets in the eye, tickles around underneath the eyelid, irritates the epithelium in the cornea, and those fibers are carried in part by the nasociliary. So I think that's it for this little short piece on the trigeminal nerve, the ophthalmic. Yeah, so the next lecture we'll do the maxillary branch. So it's there's not a lot here. Just keep the branches of the frontal nerve clear, and then what the lacrimal nerve is doing, and the nasociliary, and you should be good. There's not a lot more information that we're going to do on the ophthalmic. Okay? So, we'll see you soon. Bye.